Hi everyone, welcome to Dr.Tidy. I am Dr. Hari, Principal, Care College of Physiotherapy and Paramedics, and also Consultant Physiotherapist at Divya's Physiotherapy, Wellness and Rehabilitation Center. Today I would like to explain about a patient who underwent left shoulder Hemi Arthroplasty. Before explaining about the condition, let me brief about the history. This patient had a fall on outstretched hand and she broke her proximal humerus. And immediately she was rushed to hospital. After taking to the hospital, on examination, it was found that the normal counter of the left shoulder was lost. There is crepitus positive and tenderness present at the shoulder joint, and there is gross restriction of movement due to severe pain. On palpation, distal pulses are palpable on both the hands, and range of motion at wrist and elbow are preserved. She is able to do range of motion of her wrist and elbow joint. So later X-ray was taken. X-ray shows proximal humeral fracture with the involvement of the humeral head, and for later, in order to confirm, CT scan was performed and it was diagnosed that she had a 4-part fracture of her proximal humerus along with dislocation of her left shoulder joint. After diagnosing, she was planned for Hemi Arthroplasty of her left shoulder. Surgery went on well, and post-surgery she was discharged from the hospital on 3rd post-op day, and she was advised to review in the hospital after 2 weeks. After discharge, she was advised physiotherapy, but she couldn't perform well due to severe pain and discomfort. She couldn't do any physiotherapy. After her surgery, it was noticed that the sutures were not healed properly. There is gapping in the suture line and minimal oozing is positive. So culture sensitivity was done for the oozing, and she was kept on high antibiotics and on regular dressings for the gapping. So it took almost 4 weeks for the wound to heal. So after 4 weeks, she was referred for physiotherapy, and initially when she came to me, I assessed her and it was found that her active range of motion was 0. There is severe disuse atrophy positive, and there is severe wasting and post-traumatic stiffness. The sutures healed, but the passive range of motion is pain-free and it is not that satisfactory. She is able to perform only 90 to 100 degrees of her shoulder range of motion. After doing continuous and vigorous physiotherapy for 1 month, she is able to attain 90 degrees of forward flexion, 60 degrees of abduction, and she started doing her activities of daily living. There is severe disuse atrophy and her range improved gradually. In this video, let me show how she recovered and what are the different type of exercise that needs to be performed. We'll see the progress in my next video. If you like this video, please like and subscribe to this channel for more interesting videos. Thank you.